Public Health Department of NHS Lanarkshire and the Infectious Diseases Unit is working with both the North Lanarkshire and South Lanarkshire Council and other agencies to investigate and manage an outbreak of acute hepatitis A. While numbers have gone up, numbers of confirmed cases have gone up, this is what we expect based on what we know about how they've been exposed to the possible source of the outbreak. We expect to continue to see a number of confirmed cases present to GPs and to the hospital. That's because we know that a significant number of those who have presented unwell have reported having eating certain products produced by a local bakery, JB Christie's, but within a particular period of time. So it's quite important that people who have actually consumed sort of sweet pastries and decorated cakes and things like that from either produced by that bakery or from that shop and who become unwell with the following symptoms: nausea, headache, fever, abdominal pain, and some will present also with diarrhea, or if they present with jaundice, which is the yellowness of the eyes or the skin. It's quite important that they contact their GP, and if it's out of hours, to ring NHS 24 on 111 number. The sooner you do that means that the quicker you can get care. And after getting care, generally speaking, the infection doesn't last a lifetime. It clears up, and the majority of people recover. Only a small proportion may see much more serious illness. NHS Lanarkshire has worked with NHS 24 to establish a special helpline. The number is displayed on the screen for people to contact to get general information about acute hepatitis A. It is not a clinical helpline, but it's a helpline that provides general information, so people are aware of the symptoms, aware of what their options are in terms of getting help if they're unwell or if they're concerned that they may have been exposed to someone as a close contact who has acute hepatitis A. Hepatitis A virus is usually a foodborne virus that's transmitted through contamination of food sources. And the commonest route for that is poor hand hygiene. So it's very important that people pay attention to their hand hygiene after using the toilet or before making food preparation. We think it's also important that if you have a young child in the house, usually those under 5, that you pay attention to their hand washing and you help them to make sure that their hands are properly cleaned, especially after using the toilet. This will go a long way to stop this current outbreak of acute hepatitis A, but also a wide range of infections that are transmitted in exactly the same way.